welcomes you as well.
Good. Calm down. Lovely. Can we do an interview? Alrighty. So, are you ready for your 73 questions?
I guess I am.
Oh, what is your name?
I'm Elizabeth Rutkowski.
And what is your specialty?
I am a neurologist.
And how many years have you been practicing?
I've been practicing too many years to remember. I'm on my 7th year of being an attending though.
Okay. So, where did you go to undergrad?
I went to undergrad at University of California, Berkeley.
And medical school?
And medical school was at University of South Florida in Tampa.
Did you take any gap years before going to med school?
I actually took 2 gap years. I did a master's for 1 year, and then I actually taught high school chemistry for a year before applying.
Oh, okay.
Yeah.
So, I know it's been a bit, but do you remember what was your favorite part of medical school?
I think being able to see patients for the first time, it's very trite, but I think that plus a trip that I took to Bolivia, where I did a medical mission trip, that was really fun.
It's awesome. So what specialty did you think you were going to go into on your first day of med school?
I studied neurobiology as an undergrad, so I was always interested in that, but honestly, I fell in love with every specialty, so it was a tough choice.
That's awesome.
Can I get you something to drink?
Sure. Just water, maybe sparkling water if you have some.
Sure.
Feeling a little fancy today. We're still on summer break. So, what changed your mind about the specialties that you didn't choose?
Well, I felt like there were a lot of things with each specialty that I wasn't okay with. So with OB-GYN, I really loved delivering babies, but I didn't like gyne. For peds, I love the children, but I didn't like the parents so much. So I joke around, I hated neurology the least, but I kind of, felt that it was a lot better than when I studied it in undergrad.
Understandable. Were there any specialties out the gate you immediately said, not for me?
Actually, no. I really went in with an open mind for every single specialty.
That's how it should be. Well, what first made you fall in love with neurology?
I think it was being able to do a neurological exam. It's kind of like a dying art, and it was one of the few specialties I felt like the exam really, really mattered still.
Well, for those who may be interested in going to neurology, thank you. How long does your training take after med school?
It's about 4 years. If you want to do fellowship, that's another 1 or 2 years afterwards.
Now, speaking of fellowships, are there any fellowships to further subspecialize in neurology?
Sure. There's tons of different specialties depending on what you like. I mean, there's inpatient, so there's neurohospitalist, neurocritical care, stroke, and then on the outpatient side, there's movement disorders, headache, and epilepsy, to mention a few.
Did you ever consider getting any other degrees, like an MBA or an MPH?
I don't think I did because I came in with a master's already, and it was just too many years of schooling already.
Understandable. So what would you say is the most unique part of your specialty?
I think that there is a really, really wide range of patients that you see. So you see super, super young to super, super old, some that are not sick and some that are terribly sick and on the brink of death. So it's a really wide gamut.
What does an average day look like for you?
I'll probably get up around 7 in the morning, head out to work, round with my residents. I work in an academic practice, so we round probably from 9 a.m. to noonish, and then I usually have a bunch of meetings or teaching in the afternoon.
All right, so now this is the fun part. I always let physicians try to put their car salesman cap on and try to sell their specialty to any prospective student out there. So why should someone choose your specialty?
First of all, it's a growing field, so you will always have a job. There are a ton of baby boomers that are aging at the same time, so there's a big need for neurologists. Young patients, old patients, everyone needs a neurologist, and we treat a lot of very common problems like headaches. So you'll always have a job, and hopefully our salaries will be increasing as that happens as well. And I think that there are a lot of different opportunities. It used to be combined with internal medicine, and you a lot of people like internal medicine because you can go into a lot of different specialties, but with neurology too, there's so many different subspecialties that you can go into, and you can kind of generate the practice of your dreams.
Flip it around, be a devil's advocate. Why should someone not choose your specialty?
That's a great question. Maybe if they don't like treating patients with disabilities, if you like overall super healthy patients, I think most neurologic disorders are associated with some degree of disability.
All right, another fun question. Are there any stereotypes of your specialty?
Well, they always joke around that it's like a diagnose and adios specialty where we do a great job of localizing the lesion, but when it comes to treatment, we're out of options. I don't think that that's true as much anymore. There's been a lot of recent advancements.
Well, next question is, are any of the stereotypes true? But I guess you debunked some of those.
Yeah, I think that in some areas, like maybe subacute stroke, we don't have as many options. So yeah, that might still hold true.
All right, so you said you're attending. I know you interact with a lot of students, and there's this thing attendings like to do, some people call pimping. So what is your go-to question to ask your students on the wards?
I like to ask my students what they want to go into. Sometimes I feel like whatever they choose, I have a neurology plug for them. If they're deciding to go into emergency medicine, I'm like, you're going to see a lot of strokes. You need to know how to treat acute headaches. If they're going into family medicine or internal medicine, you need to know how to treat back pain and neck pain. So I kind of appropriate what types of things that they'll need to know in their future career.
All right. And every physician starts out as a student at one point. So what was the craziest question you were ever asked by one of your attendings?
You know, it's been so long that I honestly can't remember. Yeah, sorry.
Okay. Well, since I'm about to begin my psych or neuro block, what in your opinion is the hardest concept or disease process for med students to grasp?
I think lesion localization is a really big one, and the nervous system is sort of all over the place with tracks crossing or staying ipsilateral, contralateral, and I think that can be very discombobulating for a lot of students.
Can't wait. So, how many patients do you see on an average day?
It depends. Neurology is very telemedicine focused these days, so I would say on average about 20, but it can be as much as 50 to 100 if it's via telemedicine.
What's the most amount of patients you've seen in a day?
Yeah, probably in the 30s range that I've seen in person, but we can manage up to like 100 patients at a time.
What is the most common illness you see patients come in with?
Gosh, all neurologic disorders are common, so probably headaches. I see as an inpatient neurologist a lot of stroke, so yeah, that would be, yeah.
Okay. So how many hours do you work in an average week?
Oh gosh, it really depends. If I'm on service, meaning working in the hospital, it could be 100 hours. I don't want to scare anyone away. And then other weeks, maybe like 60.
All right. More important questions coming up for anyone wanting to go into neurology. So what time do you normally wake up?
I'm a morning person, but I think I still wake up around like 6 or 7.
What time do you normally leave the hospital?
It's around 7 p.m.
How many hours of sleep are you typically working on?
I like to get a lot of sleep, so I made it through med school by sleeping 8 to 9 hours a day.
How many hours of sleep are you working on right now?
About 8.5, so doing pretty good.
Good day. Now, do you have to take call at all?
I do.
Are you a night or day person?
I'm definitely a day person. Nights are kind of fun because all you see are new patients, and you don't have to deal with social work and all of that, but the hours are really hard.
Interesting perspective. So how long does it take you to chart at the end of your day?
Oh, I'm a big charter, so at least 2 to 3 hours.
Okay. A wholesome question. Who are you most thankful for on your care team?
My sub-interns, actually, they are wonderful and they are always aiming to please, so I find myself very, very grateful to them all the time.
What's the funniest thing you've seen in a patient chart? Without violating HIPAA, of course.
I've seen a lot because I deal with a lot of altered, confused patients. One of them once proposed to me on, I think it was July the 4th one year, and he said he was Usher, and he clearly did not look anything like Usher, so I was a little bit surprised by that.
I was hoping we'd get a fun one with neurology. So, what is the most common medical advice you give to your patients?
I say everything that's good for every other organ in your body, like your heart and your lungs, is also good for your brain. So exercising, staying sane, which is hard in this time, and eating healthy.
What's the most common drug you prescribe?
Probably aspirin, a baby aspirin. That's very stereotypical, but yes.
Nice. All right, so this is arguably the most important question I have for you today,
Okay.
because I don't get to ask many physicians this. What those watching may not know is that you had the pleasure, or maybe burden, not too sure, of being one of my first preceptors in med school.
Okay.
But while you were my preceptor, you were preparing to have a new addition to the family.
Yes.
And, I'm a guy. I'm never going to have to experience carrying around a child for 9 months. But I think it is so, so important for future female physicians to know how having a child impacted your schedule and workflow as a physician.
It was very, very challenging. I don't think anyone ever warned me that first, being pregnant and working a full-time job is very hard because your energy is like this. But I think if you have a good boss that's willing to work with you and arrange your schedule appropriately, that helps a lot. A lot of women run into medical problems during their pregnancy, so that can be kind of a wrench. And I think the unpredictability can be really, really hard in female physicians who are typically go-getters and, physically fit and like excel at everything. And then the aftermath, of course, is, it feels like just being on call for months and months at a time, where you're up every few hours with the baby, then coming back to work and realizing now you have 2 full-time jobs. So I'm not gonna lie, it's a lot of work, but getting as much help and support from family, hired help, as much as you can get, will definitely help you out.
Very well said. So we've talked a lot about life inside the hospital. How about your life when you clock out? So what is your favorite thing to do when you're not working?
I love to work out, which is harder and harder with more people that I have to take care of at home. But yes, I think that's probably the one thing that keeps me sane and happy.
And what is the little one's name?
His name is Wesley John.
Wesley John.
Yeah.
Oh, does your family ever ask you for random medical advice?
All the time.
What's the craziest question you've been asked by a friend or family?
Not crazy, but I probably get pictures of rashes every day to every other day, and
Classic.
No one tells you in med school how important dermatology is, because everybody has rashes, and nobody, I think even dermatologists don't even know what all the rashes are because they biopsy everything, but you'll get a lot of those questions too.
Yeah, we only spent 1 week on dermatology.
I know, you better study hard.
Any pets? Well, I think this is the time to showcase.
Yeah, this is Littlefoot. She's been with me all throughout residency. She's
Yes.
almost 10 years old.
You probably hear all the little footsteps on the hardwood floor throughout the
Yeah.
audio.
Yeah, let's give you
No?
a treat, Littlefoot.
Favorite animal, not a dog or a cat?
Probably. I'm not quite sure. I've really only liked dogs my whole life. Yeah.
One track. So, if there's one place in the world you could visit, where would it be?
It would probably be Bolivia. It's one of my favorite places to visit.
If you could have dinner with anyone in history, who would it be?
I think maybe my great grandma. She passed away when I was little, and I think that I wish I learned a little bit more about my history from some of my relatives who lived in North Korea and emigrated.
So, what would you guys be eating at that dinner?
Probably some Korean food.
What's your favorite dish to eat?
I like this spicy tofu soup.
Ooh.
I don't know if you've had it before. It's so
I
good.
think I actually had some yesterday while I was in Atlanta.
Oh, I'm so jealous.
Any favorite restaurants around here?
Actually, we go to this restaurant called Cork and Flame a lot. It's like just around the corner.
Coffee, tea, or soda?
Oh gosh, all of the above. You didn't add wine in there though.
Ah, okay.
Yeah.
I gotta make sure I add that in for the next one. Of these. All right. This question is hilarious because every physician gives me a different answer.
Okay.
How much water should you be drinking every day?
I feel like 2 liters. Yeah, it's good to stay hydrated. It really prevents headaches and a lot of other neurological problems.
Yeah. Favorite meal from the hospital cafeteria, if you have one?
Oh, they have this Thursday baked potato day that is so delicious. It is like chock full of bacon and cheddar cheese. You have to check it out.
You're not the only person who said that.
Really?
That's funny. So, one random task you'd say you're really good at.
I like to memorize the backs of like cereal boxes, or I know that you guys don't eat this around here, but In-N-Out burger wrappers. As I eat, I just memorize what I'm eating, I guess.
That's cool. All right, flip it around. What one random task do you wish you could be better at?
Directions. I'm just the stereotypical Asian female, but I have terrible direction sense and my driving is awful, so I could use some help in that area.
All right, controversial question. Pineapple on pizza, yes or no?
No, absolutely not.
Okay. So, favorite season of the year?
I like summer.
Summer, okay.
Yeah, I love hot weather.
Any artistic hobbies you keep up with?
I used to make jewelry. I don't say that I keep up with it, and I used to play the violin, and I'm trying to get back into that.
Mm-hmm. Well, speaking of music, top 3 favorite music artists.
Oh, well, I love J.S. Bach from the classical period, but I like a lot of deep house, actually. So anyone in that genre is a yes for me.
Okay. And what is the best way you relax after a long day?
Probably some wine, I'm not gonna lie, and going for a walk.
Okay. Night in or go out on the town kind of person?
Probably go out on town, but that's been a little bit harder in recent times.
Mm-hmm. So indoors or outdoors?
I would say outdoors, especially when the weather's as nice as this.
Speaking of outdoors, beach or mountains?
Actually, I like both, but probably beach because I like warmer weather.
Okay. Would you consider yourself more of an introvert or an extrovert?
Introvert for sure.
And do you think that personality trait had a factor in you choosing your specialty?
I think so, actually. Most neurologists are introverted, in my opinion.
All right. Well, we're getting close to the end. Only got a few more questions, but these questions are going to be more reflective.
Okay.
So, what did you think you were going to be when you grew up as a kid?
I actually wanted to be a ballerina, so it's a little bit different from neurology. But then I wanted to be a teacher, and then I thought, okay, well, if I can be a doctor and a teacher, then it would kind of be the best of both worlds.
Is there a different specialty you think you could have done?
I think I could have done a lot of different things and probably been happy, but I love neurology, and I find that most neurologists stick with their profession, so
Okay.
a little foot.
If you didn't do medicine, what do you think you'd be doing right now?
I actually really like artsy stuff, so I always thought I'd be a calligrapher, like do wedding invitations and signs for people, or something on Etsy, I guess.
That's awesome. And you said you didn't have too many artistic hobbies to keep up with. All right. Were there any times you doubted you would make it as a doctor? Because as anybody who's gone through this path knows, it's not easy.
Yeah, I would say almost every hour of every day. I applied to medical school, I think 3 times, and I feel like I barely got in. But I feel like that has nothing to do with your success forward. And I feel that if you really, really, really want to become a doctor, anyone can do it. You just have to try.
Well said. If you could change one thing about the medical field right now, what would it be?
It would probably be access to healthcare, because so many patients have inadequate access, and we have trouble getting them the medications that they need.
If you were to go back, would you change any of your experiences that got you to where you are right now?
I don't know that I would change anything, but I wish I could go back and tell my old self just where I'm at now, to encourage myself to keep going, and that everything always, always, always gets better, and all the hard work is worth it at the end.
So what can a medical student do right now to prepare to go into neurology?
I think shadowing, trying to find out someone who has either an inpatient or an outpatient practice, and then learning about the neurological exam, I think, is a great way to prep yourself for your future.
All right, and now finally we are on question number 73.
Wow.
What would you say to the aspiring neurologist right now?
I would say be interested and stay engaged. They've done a lot of studies that the more curious you are, the more wise you will be. Don't have a fixed mindset. Continue to grow, and the more intellectually curious you are, the more you're going to learn and absorb like a sponge. And that is what makes the best type of neurologist.
Alrighty, well thank you so much, Dr. Rutkowski. It's great to see you, and that's all I have for you today.
Yeah, thanks, Andy.
Thank you so much for your time.
Bye.